Okay, chin acne, something that has just plagued us all over the last 2 years. So if you have chin acne that's deep cystic acne, really that's hard to treat with topicals. It's usually caused by hormones, and the hormones can be estrogen that's being converted to testosterone. It also can be stress hormones that are converted to testosterone. And both those can lead to these deep, painful pimples that then oftentimes leave a shadow for weeks until months. If you're young, if you're 25, those deep cystic acne spots will usually resolve over a couple weeks, but over the age of 35, those shadows can stay so long that they're still there when the next round of pimples show up. For this group of acne, really seeing a dermatologist about treatment options is going to make a big difference for you. One of the most popular treatments is an oral medication called Spironolactone, which is very safe. We use it in very low dosing, but it is an actual water pill or diuretic that also inhibits the conversion of estrogen to testosterone. So it really helps with that hormonal acne. And it's something that does take a month or two for you to see the results from. So you have to start it and you have to hang in there, but that can work really, really well. It can be taken alone, it can be taken with birth control pills. Very rarely, when someone has a big event, I might start them on spironolactone and let them take doxycycline for a little while. Doxycycline is an oral antibiotic that's also a powerful anti-inflammatory, so that can help settle down the pimples a little bit faster than the spironolactone will do on its own. Lastly, if you have a huge event and you have a deep goomba coming in, call your dermatologist. We will inject Kenalog or a steroid in a very small amount into the pimple to shrink it down so it doesn't get so inflamed. My joke is that during the wedding seasons, I always travel to all the weddings with Kenalog or a steroid injection in case there's a wife or a mom or a bridesmaid who is worried about having a big pimple in their photos, and I will inject them just to be friends of the bride. So deep cystic acne, hard to make go away on your own at home. Yes, I could tell you, control your hormones and don't be stressed, but that's really hard to do. So go see a provider. Consider oral medication. Spironolactone is fantastic. Doxycycline sometimes is helpful in combination. And then also over-the-counter options that can be mildly helpful is spot treatment. So when you have a deep goomba, a superficial treatment like benzoyl peroxide is just going to dry out your skin and not be helpful. But anti-inflammatory spot treatments like sulfur will actually help get some of that swelling out. And even those hydrocolloid band-aids, those can sort of help pull the inflammation out and pull the acne to the surface. Using tretinoin or over-the-counter retinol on a nightly basis, or at least a few times a week, will help erase some of those leftover shadows from those deep cystic acne. So that's another great thing, just to keep the chin looking good, having to have fewer spots, but also help prevent sort of congestion. But again, anything that you put topically is not going to penetrate as deeply as something that you take orally for those deep cystic pimples. Now, the other type of acne everyone's getting right now is the superficial stuff, where your skin is irritated, you have little whiteheads, you're flaky, and it oftentimes is worse when you're wearing a mask a lot. So this is a classic example of your skin biome being changed because of you wearing the mask. Our skin is supposed to be acidic. It's called the acid mantle, and if the pH of your skin is acidic, it makes it better and happier and a healthier place for the good bacteria and the good organisms to grow. Once you change your skin biome, that oftentimes gets out of whack, and organisms that your skin doesn't want to grow become overgrown and actually prevent the growth of the good organisms. So as gross as that sounds, you actually really want your skin covered with the good organisms, and the question is how do you do that when you have to wear a mask all day? Well, first and foremost, do not scrub, wash your face over and over and over again. Those steps actually raise the pH of your skin even more and make it more likely you're going to be further irritated. So when your skin is irritated, inflamed, even if it looks pimply, really cut back to washing your face once a day, only at night before you go to bed, and use a face wash with a pH less than 7. So often face washes are basic and actually raise the pH of your skin, getting rid of that acid mantle that we want to have be there. After you wash your face, don't use retinol, vitamin C. Really allow your skin to take care of itself and just follow it with a nice sort of supportive moisturizer. And clearly my face wash and my moisturizer are pH balanced and great to use in this situation, but there's lots of other good ones out there. Something that's becoming really popular are skin products that have probiotic or skin biome ingredients in them. So for example, my face wash has radish root ferment in it. That is considered a prebiotic that's good for your skin. There are others that have sort of actually objective probiotics in them. It's very hard to control probiotics in the skin creams and treatments specifically. It is better to get those probiotics by taking a medication. So baby your skin, wash your skin, put a moisturizer on, and then if your skin biome feels out of whack, do take an oral medication or an oral skin probiotic. So there's probiotics that are made for our gut, but now there's a number of probiotics out there that are actually formulated for our skin. And the one I recommend the most is this one. It's the Skin Squad. And what I find with my skin, a number of my patients, even just taking one of these pills a day for 3 days can make a big difference in helping the skin biome go back to normal. Now, we don't have a lot of data on how long you need to take these pills and if they're safe to take forever. So I don't tell people to take them forever. I tell them to take them until their skin clears up, then put them in the fridge and get them back out if they need them. Now, sometimes what's going on with your skin is more than just taking a probiotic can take care of. And with wearing a mask, it can make it so that organisms from your nose creep out onto your skin, something like Staph Aureus. And that is going to require a trip to the dermatologist, a culture to make sure we know if it's resistant to anything, and then oral antibiotics for as little as 5 days and sometimes for as long as 2 weeks. Also, sometimes with mask wearing, we have an overgrowth of mites or parasites or yeast, and those also might need a prescription. Something that I'm seeing a lot of now is overgrowth of the Demodex Mite, and that shows up with sort of bumps, but also just change in texture and like prominence of your pores, and it can happen in your chin, it can happen on your forehead, and that's something where a prescription called Soolantra, which is actually topical ivermectin, can be really helpful for. So when you have sort of that irritated, bumpy skin on your chin, but it's superficial, there's things that you can try at home. First, baby your skin. I know we're all sort of taught, oh God, my skin's misbehaving, let's throw more at it. But really, your skin can take care of itself if you let it. So don't mess it up. Don't change the pH of your skin. Wash with a gentle cleanser, moisturize with a supportive moisturizer, and give your skin a couple days to settle on its own. If you're feeling motivated, sure, add in a skin probiotic, but outside of that, just wait. If that isn't enough, if the rash continues to worsen, if you are worried that things are getting worse, do call your dermatologist, and then they can see you, do a culture, and give you a prescription that might help clear things up a little bit faster. If you have any questions, just let us know. It's great answering them, and have a great week.